Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hey everybody, so it's Q&A Friday. So there's 3 questions, very good questions. And the first question comes from Nicole. She asks, what can be done about your fingers and arms aching? Feels like bones hurting, no relief besides taking meds. Well, it sounds like your body is reacting to something. This is where I would like to emphasize the importance of reflecting on what you're putting into your body that may be potentially contributing to your symptoms. I would make an educated guess that you have a histamine reaction to something that makes you itch. So the best thing to do, short of taking medication, is to get on an elimination diet to clear your body of all potential inflammatory foods from your diet. Then once the overall inflammation is decreased in your body, it's amazing how those symptoms can subside. And as an added benefit, you can also take select supplements. I've gotten great relief and results from my patients as well as for myself from 3 grams of very good quality EPA DHA, which is fish oil, and curcumin up to 1,000 milligrams per day, which will help you to reduce pain faster for those fingers. So I hope that helps. And second question comes from Lisa, and she asks, the alkaline diet has lots of greens in it, especially the smoothies, which I love. I take aspirin for AFib, and I know too much vitamin K is not good as it thickens the blood. Any other good options? So the aspirin is prescribed for a potential blood thinning effect. And if you're on a low dose aspirin therapy, then I would ask your doctor about replacing it with therapeutic dose of potentially fish oil. It might be just as effective. As for vitamin K is a naturally occurring vitamin, which is primarily found in leafy green vegetables, such as spinach, broccoli, and lettuce. And it's in most nutritional supplements as well, and it's produced in your gut through interactions with your gut bacteria. Vitamin K helps your body to clot to prevent you from bleeding out. And vitamin K is a concern mostly for people taking Coumadin, as Coumadin is a powerful blood thinner that interferes with your body's vitamin K usage. So I would tell you that there's a very little concern for you with eating lots of greens. If you were seriously concerned, you can measure what's called INR, International Normalized Ratio Test, which is a standardized way to measure how your blood is clotting. The lower your INR, the faster your blood thickens, and the higher your INR, the longer it takes to thin your blood, putting you at risk for bleeding problems. There are other reasons, such as medications, antibiotics, and herbal products that may also influence your INR, so it's better to think about the bigger picture. I hope that I answered your question. I know that was a roundabout way to answer it, but I always come back to having sensible balance in the way you approach your health. Okay? So last question comes from Norrison, and she asks, I was just diagnosed with having lung fibrosis. Is there anything that can be done to prevent it? Well, pulmonary, which is lung, fibrosis can be a result of multiple things such as toxic exposure, medications, radiation treatments, and certain diseases like lupus. In the conventional medical world, it's one that can't be reversed. But I would argue that it's the underlying inflammation that causes fibrosis of our tissue. And for pulmonary fibrosis, it just happens to be in your lungs. We have many other fibroses of the breasts, the abdomen, the polycystic ovaries, etc., which to me are along the similar lines of inflammatory conditions. Doing what you can by incorporating a healthy alkaline shift is the best thing you can do. Start with the elimination diet to reduce the amount of inflammation that you're introducing into your body. Hydrate, exercise, and go do everything you can, or everything you can potentially, to get a good night's rest as well. So common sense is not always common practice, and it's the most important to start with the basic fundamentals before looking to other complex options. I hope this helps. We're here again next Friday, so please write on the pinned post of Q&A in our Lupus Rebel Facebook group. Those of you who are watching us on YouTube, please like, subscribe, and follow us on Instagram. We put out a lot of specials, and we're going to plan to do a lot more in the near future. So I'll see you guys next week.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com